Welcome back to our Caregiver channel. I hope you've had an opportunity to look at some of our other offerings on this channel. They're there for you. Check them out. I think they will help. Today we're going to be talking about care for stroke victims. But before we get there, I want to remind you to listen to the professionals. They're there to help you. They will help you. Their instructions are important. This channel is here to support that instruction as well as give you some ideas from a practical at-home experience. Now, the stroke victim is a little bit different than the care for a general decline. That is, this individual very often will be depressed. They'll be discouraged. They'll be in pain and worry. Now, your job, of course, is patience. Patience to work with them, encourage them, and get them moving in the right direction. This will be incrementally, a little bit here, a little bit there. I wish I could tell you that it's all going to be from one level and then smooth sailing downhill. Unfortunately, it won't be that way. Very often, there'll be peaks and valleys in that process. But stick with it. Be encouraged as you encourage them that there will be improvement over time. Taking the time to allow the time to work on your behalf. With strokes, usually the arms and the legs are affected. It could be just arms or just legs. Very often it can be the entire left side or the entire right side. Often speech can also be affected with strokes. It's important to know this from your doctors, your nurses, your therapists, what they are saying and what they are recommending for the care. This way you'll be completely armed as you begin the caregiving assignment for that stroke person. So with strokes, you can help that person begin to get back to some sense of normalcy by just helping them get dressed and having them, of course, participate in that process. When helping someone who does have an impairment, now in this case, this is a left side impairment. You want to take the garment, it could be a blouse, it could be a shirt, or in this case, a coat. You want to actually thread through the impaired side, helping the individual bring their arm in and through the jacket as they help with the right arm getting it up as well. This gets them involved. Bring it around. Have them go ahead and loop in to the right side, and you've completed the task. Now again, remember, you want them involved in this process. It would be the same thing if you were putting on leggings, pants, or any other kind of lower extremity item. Always deal with the impaired side first and make sure that they're involved in the process. When speech is impaired, having a whiteboard and some instruments for communication is important. Now, this whiteboard is a little large, so you might want to use something smaller, and they do have them in handheld sizes. But these are typical speech assistant devices that can be used. An instrument called a lithograph can also be used to help with communication. Your speech pathologist can help you a little bit more on getting information on this. But with a simple click,
my favorite foods
can be displayed, and in this lithograph are a number of symbols that can be touched simply to assist with communication. Understanding what's needed in terms of diet is very important. Sticking to the plan that's been outlined by the professionals, your speech pathologists, your doctors, your nurses, is critical. Please do not deviate from this. If you feel that there is a change needed, particularly as the individual complains about the diet, check with the professionals. Get their guidance. If they make the change, then you can make the change. If not, help the person be patient through this process. Well, that's our segment on stroke care today. Remember that the stroke victim is often depressed, discouraged, and will need your help and patience and encouragement. I wanted to also remind you about the other segments that we've covered here on this channel and encourage you to watch them and share them with others. Next week we'll be talking about Alzheimer's and dementia. These are difficult issues, but we're here to help, and you'll find that the information will be useful to you. Again, subscribe to this channel. Be sure to leave your comments and be with us again next Friday at this same time. We look forward to talking to you then. Take care.